We know EDs and presentations are growing kind of 6 to 8% year on year. That's never stopped. So I think we're in that space to really make a difference.
This is Calvary Adelaide, the largest and newest private hospital in South Australia. It opened its doors here in the Adelaide CBD in January of 2020. While there's 345 beds up there, for many of those patients, the front door of this hospital is here at the emergency room. And while this ED looks like many others around the country, there's a significant difference in the way it's administered. That's because both here at Calvary Adelaide and at Buderim Private Hospital on Queensland's Sunshine Coast, the emergency department service is run by a company called Care 24/7.
Care 24/7's main value proposition is in our name. We provide care 24 hours a day, 7 days a week.
The founding director of Care 24/7 is Dr. Sharat Pandit, who's worked for decades in emergency medicine all over the world, including the UK, Germany, the United States and Australia.
We staff the emergency department with specialist emergency physicians. That takes a whole lot of stress out of the executive, who are actually quite busy running the organizations, running hospitals.
And anything changes around that shoulder, like you notice bulging or redness or feeling heat.
Care 24/7 recruits and retains emergency doctors. It manages governance, HR and rosters. It's also developed business intelligence tools to report and monitor the performance of the ED, while connecting patients with specialist services through the hospital.
They're highly trained emergency medicine specialists. They come at a cost, and being able to manage that workforce is quite a challenge as well. So that's probably the number one challenge for the hospital at the moment.
At Calvary, the ED is not seen as an outsourced department, rather a partnership.
We have a number of partnerships with all types of people on our site, but 24/7 are really important to us. We expect them to provide medical care consistently and of a high standard to all patients that present, and then I rely on them for some advice.
We don't see this as basically an us or them type of approach to it. It is actually a fully integrated emergency medicine department. For all intents and purposes, we are part of the hospital system itself. And we do add value to the hospital in that space.
An example of the partnership benefits came during the early days of COVID, when elective surgery was cancelled and infection control was paramount. One channel that remained open for admission flow into the hospital was the ED, and Care 24/7 worked to put patients through while managing COVID risk for the hospital.
Without those relationships, we couldn't have had those tough conversations and or work with the hospital executive to optimise the emergency department and the presentations through to the hospital as well.
It's very rare that you get a thank you or a geez, whereas that happens to us every day.
After 20 years in the public system, Dr. Mike Natale is now Medical Director of the Buderim Private Emergency Centre.
It's always interested me, the private side of things, not unlike any of the other subspecialties, that you actually have your own patients, you get to draw pictures, spend some time, and really build an environment where we can provide the best patient journey and the best patient care, and not cut any corners, not be forced by the system to cut those corners.
In both hospitals, data is gathered to measure the patient's experience within the ED. This is measured from the front of house interaction through the clinical experience with both nurses and emergency doctors. It provides insight into areas that the teams are doing well, but equally provides great improvement opportunities to ensure that Care 24/7s are always first class.
ED is the front door to the hospital, so I expect those medical doctors to sit on some of my governance committees in the hospital, which is really around mitigating risk for patients and providing really good outcomes. As I said, things don't always go the way you want them to go, but sitting around a table and discussing them for learnings for opportunities or improvements is really important, and 24/7 do that with me often.
The patient traffic isn't as frantic as at public hospitals because Care 24/7 doesn't offer treatment for level 1 trauma or mental health. In the meantime, the partnership that meets at 2 hospital front doors continues to evolve.
That's why we're building partnerships with hospitals who are keen to do this, so that we have the resource and we can actually do our job properly. Everybody's happy to be busy. They just want to go home and feel like they did their job. And it's really rewarding. It's a pretty cool job.